MIJSC at IIMB Tatsujin Speak webinar lecture series. Tatsujin Speak is roughly translated as the expert speak. And today we have one of foremost experts in the field of supply chain in general, but medical supply chain, she has worked in great detail. So she will be sharing her thoughts and her experiences in this field. My name is Saidi Pratnam. I am the Chief Operating Officer at MIJSC at IIMB. MIJSC stands for Mizuho India Japan Study Center, which is a center of excellence at Indian Institute of Management, Bangalore. The focus of this center is to strengthen India and Japan bonds by promoting academic, industry, and societal linkages. And this webinar series we started almost 20 months ago. So is one such attempt wherein we are bringing in experts from both countries as well as other countries like the USA, the Europe, and so on, to talk about societal, technological, business, and other facets of life, highlighting both the Indian, Japanese, and the global perspectives in the field of discussion. In fact, over the 20 months, we have had, this is actually the 14th webinar in this series. And so roughly we have a month and a half is the spacing between these webinars. And today we have Dr. Özlem Ergin, a distinguished professor and associate chair for graduate study affairs in mechanical and industrial engineering at Northeastern University, the USA, Boston. So she has joined us. So I have great pleasure in welcoming her, who has a decade-long collaboration work she has done with UN World Food Program, which is the largest humanitarian organization in the world, and to develop and implement supply chain optimization and analytics capabilities. And for this work, she was awarded the Informs France and Human Tribes in 2021. Over the last 2 decades, Dr. Ergin has worked with organizations that respond to emergencies and humanitarian and public health crises around the world, including, of course, USAID, UN, WFP, UNHCR, IFRC, Oxfam, you name it. I think almost all the major agencies have worked with her. And Dr. Ergin has served as a member of the National Academies Committee in the US on security of America's medical supplies, and National Academies Committee on building adaptable and resilient supply chains. Recently, Dr. Ergin has partnered with the Massachusetts Executive Office of Elder Affairs to help match qualified medical professionals to long-term care facilities with open positions around the state as part of the state's response efforts to COVID-19. Prior to joining this great institute, Northeastern, Dr. Ergin was a Coca-Cola Associate Professor in the School of Industrial and Systems Engineering at Georgia University Institute of Technology, where she also co-founded and co-directed the Health and Humanitarian Systems Research Center at the Supply Chain and Logistics Institute of that institute, Georgia. She received a BS in Operations Research and Industrial Engineering from Cornell, and is a PhD in Operations Research from MIT. She did it in 2001. So Dr. Auslam will talk about many of her experiences during the recent disruptions in the different supply chains and how the critical issues of supply chain resilience is being looked at um, globally and also regionally. She will provide a review of the state of knowledge about supply chain resilience, leveraging several large-scale studies that were conducted over the past few years. And finally, she will also talk about classification of failure modes of the supply chain and try and describe the structured framework of actions which will help enhance the supply chain resilience. In fact, we are very lucky to have such a much awarded and much experienced scholar amongst us today. So welcome to this forum, madam. I would like to set the context for the discussion for today. The theme, as we have, I said at the beginning, is building supply chain resilience. And the subtitle is Strategy for Developed and Developing Nations. But Dr. Auslam feels that whether developed or developing, the responses are to be tailored to the situation, even amongst the developed nations. Therefore, the theme remains building supply chain resilience. And over to you, Dr. Auslam.
Thank you, Saidi. Thank you. And hello, everyone. Good morning, but I think it's good evening for most of you. So good evening. And thank you for the introduction. I will be talking about a framework for supply chain resilience that we developed as part of our National Academies of Science, Engineering, and Medicine in the US as a committee that was put together by the National Academies in the US. So I will go ahead and share my screen.
Yeah.
Yeah, all good?
Yes.
Mm-hmm. All right, so thank you. I know that Saidi gracefully gave an introduction for me, but just a few words about myself. I have been working on supply chain design, management, and operations for over 20 years. And a lot of my work really looks at how to make infrastructure and supply chains more resilient and how to actually recover the operations of a supply chain or the infrastructure after a disruption. So the type of work I do, I think, is becoming more and more relevant as we look at the newspapers, covers of first pages of newspapers every day these days. So as I said, most of the discussion that I will have today is based on this one report that got published by the National Academies in earlier this year. I was part of this committee who actually studied, worked on this report for over 2 years. And the report was commissioned by the Biden administration and by the Congress in the US, trying to, as part of many studies that have been going on, trying to understand what we can do to strengthen supply chains in general. But this report actually focus on medical products. However, although the focus of the report was on medical products, I believe the results and the main messages that we kind of presented to the Congress through this report is applicable to all supply chains. There is really, I would say, there was very little in this report that was particular to medical products. It was really a general supply chain study. So what I will do today is I will give you a brief overview of the report and kind of talk about how it is generalizable to any product supply chains. And then I'll take questions. Thank you. And the report is a long report. It has many case studies and details, and it is available from the National Academy's website for download for anyone. Okay. So the first thing that is really, really important to understand, and I'm sure many of you already know this, but just kind of that's something that we would like to emphasize, is the fact that supply chains are complex systems because they have multiple stages, they are global, they're kind of distributed all over the world, even for something as simple as Band-Aid. And these systems involve people, processes, technologies, and policies. So what does that mean? It means that to make a complex system that has multiple stakeholders and that is distributed globally will require complex answers. So there is really not going to be one simple answer for making a supply chain more resilient and more sustainable. Okay, so for example, if we just look at the medical product supply chains, even within that category, there are many, many differentiations and there are many, many different products. So to begin with, the medical products can be divided into drugs and medical devices. But even within drugs, we can talk about drugs that are generic drugs, which means that they're not really branded products, like they're not produced by Merck or Pfizer or like one of the big companies, but they are produced as generic drugs, which usually means that they're cheaper. On the other hand, there are also the originator drugs, which are really branded products that are much more expensive and marketed marketed by the big pharmaceutical companies. So even within the within a drug category, you will see many different subcategories that have widely different markets, users, and supply chains. So if you look at the medical devices category, you will also see some divisions, such as there are simple medical devices, there are complex medical devices, and given what subcategory a particular device falls in, it will have different regulation, it will have a different market, it will have a very different production system, very different supply chain, and so on and so forth. So production processes and supply chains, even just for drugs and devices, vary considerably depending on what product this is. So if you think about this and think about generalizing this to supply chains for all products, we will see that there is really not one way to look at supply chains for all products. We actually have to pay attention, what product particularly are we looking at? What are the particular aspects of the production process, its supply chain, its market, and so on and so forth, before we actually can design a strategy for a resilient supply chain for this particular product. Okay, so that's like one of the big main messages that we would like to kind of come across out of this study. So what does that mean? It really brings two additional insights. As I said, one is there is no one-size-fits-all strategy for increasing resilience of supply chains for all products. Because as I said, for different medical products, for example, they have different supply chains, different markets, different risk profiles, and they all require different interventions. The other point or the insight that I would like to make is that when we're looking at devising a resilience strategy for a particular product supply chain, we need to really understand the importance of the product and the shortage risk that resides in the supply chain of that particular product. So when, again, going back to medical products, within the United States, for example, there is a list of critical medical products. But this list is built by only looking at the clinical importance of a product. So if this product goes on to shortage, what will be the damage it will cause in the health system? Which is fine, and that's an important list. But this list pays no attention to the risks that are involved in the supply chain of a product. So very recently, we have seen in the United States kind of the short-sightedness of this approach by the shortage we experience in baby formula. So I don't know if you're aware, but it was all over the news within the United States, where as a country, we actually suffered and continue to suffer a shortage of baby formula. So baby, basically the food that most families feed their babies or supplement their babies' nutrition with. So it was a big deal, and it is a FDA regulated product. So you could think about it as part of a medical product category. However, baby formula was never on the critical product supply chain and critical product list. On the other hand, now that we started paying attention to its supply chains, we see that there were many different types of risks in a supply chain. So we should have actually given more attention to baby formula, because although it wasn't a critical product, its supply chain contained elements that made it vulnerable to shortages or disruptions. Okay, so this committee that I was part of really pushed for a term, like a new term to be developed, and called supply chain critical medical products. So it's not just critical medical products, but supply chain critical medical products, as those that are both medically essential and vulnerable to shortages. But this can really be again, extended into general supply chains. We should really not only look at the criticality of a product, but we should also really mind and analyze and try to understand the risk and the vulnerabilities to shortages and to disruptions. Okay. So continuing on. So the other issue that was very important for the medical products particularly, but is something that is really important and that's been discussed throughout the world, is the globalization of supply chains in general. So not only medical products, but any product really is supply chain for any product has become increasingly global, because of different trends and many different forces that I will not get into right now. But in general, products are increasingly sourced. Their production is increasingly sourced in globally, but not only the production, but the raw materials, different components, different subcomponents of a product is increasingly sourced from all over the world. Right? And this is done because there are benefits to it, such as lower costs, sometimes increased supply security, and with the lower costs, we also get affordability of the products in general. However, of course, there are drawbacks. So particularly for a product such as a medical product, it is more challenging to inspect and regulate an international production. So there are issues regarding quality and the safety of the products, but there are also issues around transparency or the lack of transparency of not the production and the processes, but also the sourcing in the supply chains. And it becomes, as supply chains become more and more global and distributed, it becomes harder to assess their vulnerabilities, okay? So at least within the United States and somewhat with the COVID-19 crisis, there has been an increased call for onshoring of the medical product manufacturing, and not just medical product manufacturing, but chips, some of the other shortages that have been going around the globe and impacting many important products around the globe. So, however, while there is some maybe justification around the calls for globalization. Again, the committee and myself personally believe that this is an issue that needs to be considered as one potential measure for making a supply chain more resilient, perhaps, right? But it is just one measure. And it's a complicated measure of resilience, because what does it even mean even to start thinking about globalization, onshoring a product's supply chain and manufacturing? Does it mean we move only the final assembly onto domestic and domesticate the final assembly? Or does it mean we're moving all stages of production, including raw materials, domestically? So the first approach will be kind of misleading, in the sense that just pulling in the final assembly of a product and making it domestic really leaves the supply chain still vulnerable to other types of disruptions to its supplies and raw materials and so on. On the other hand, moving all stages of a production and supply chain and all the supplies to a domestic setting will usually become increasingly expensive and probably not possible from a cost perspective. So again, to repeat, we believe that onshoring or domesticating a supply chain and production should be considered as one of the options for building resiliency, but it should be part of a set of tools and not the only tool. And while evaluating this kind of an option, we should also keep an open eye towards the cost that it will involve. Okay. So the committee, basically, after we've gone through a year and a half of study, came up with a framework that is, I think, relevant to all supply chain resilience activities. And we believe the framework we came up with can be represented best by this picture, which is also from our report. And let me explain the picture a little bit. So we believe that as we live through our lives, there will be triggering events that are disruptions. And these triggering events could be demand surges. For example, like the COVID-19 pandemic caused demand surges in certain products. There could be capacity reductions. This could be a reduction in manufacturing capacity. It could be a reduction in transportation capacity and other types of capacity reductions due to events such as natural disasters, man-made events, and so on and so forth. And there could also be disruptions due to coordination failures. And what does this mean? It means that we still sometimes observe disruptions and shortages when there is enough supply to meet the demand, the global demand. However, the connection between the supply and demand is broken, right? So sometimes it might, so an example for this could be, a particular country or a particular, let's say, health system hoarding too many products and really storing and pulling away the needed product from the market, although they don't have that much demand for themselves. So that could be like a coordination failure. So we believe that there is a set of measures that any country or any firm can put in place to make sure that these triggering events will not end up harming the population or harming the final customer. And these measures can be categorized into four groups. So I will start with the bottom, which is the awareness group. And the reason that I will start with the awareness group is because we believe that information, communication, and analytics that use this information, the shared information, to turn it into knowledge and actionable knowledge is the most important part of making a supply chain resilient. And we believe that if we don't have this kind of bottom layer, the other layers, all the other shields that you see on the slide are really will not be standing on firm ground. So the first that the first thing that we kind of advocate for is openness, information sharing, and also building analytical capabilities that will take this information around your entire supply chain and turn it into actionable information so that you're not reacting to what you see is happening in your supply chain, but you're aware of what's going on. And you can actually take actions or preemptive actions before actually things get so bad. Okay. So after this category, I'll start with the shields. The first shield is the mitigation, which is really the shield that is kind of a preemptive shield. So it is about thinking about, even if a triggering event happens, what can I do so that this event's impact will not turn into a shortage. Okay, so this could be hardening your supply chain. It could be around activities that will diversify your supply chain. But if we have a good mitigation shield, the impact of that trigger, which I show here on the slide with the red balls, might actually get deflected, okay? Or it might actually get reduced. So of course, there is no 100% guaranteed mitigation strategy, meaning that even if you have the best shield, there will be some events that will be large enough and that will go through your mitigation shield. Then we talk about set of measures that we categorize as preparedness. And these are the types of measures that tries to protect, again, the population from an event turning into an actual shortage. So what do I mean by that? So for example, let's say that there's a production failure or production capacity reduction due to some kind of a shutdown in a manufacturing facility. If we had enough inventory in place, then although there's a reduction in production, this event might not actually turn into a shortage, okay? However, as before, as in the mitigation category, there is no preparedness that anyone can do that will 100% protect a supply chain from or like make a supply chain 100% resilient. Furthermore, there are many types of activities that a company or a country can take within the preparedness category. So we can think about inventory stockpiling, we can think about capacity buffering, we can think about other contingency planning activities to be prepared. And what is really important here is that we should think about different actions as part of domino pieces that are falling together and fitting together to prepare or build the best shield possible. So for example, inventory is a good preparedness measure to respond to a shortage to respond to a disruptive event immediately. If you have inventory in your warehouses, you can immediately release that and really be okay for the first, let's say, time span after a disruption. However, no one can hold enough inventory to not go into shortage for an indefinite disruption. As the length of the disruption increases, obviously inventory becomes not enough as a resilience or preparedness measure. So you should think about how can we actually build manufacturing capacity that is maybe flexible and maybe intelligent, so that the need for a certain product maybe can be the shortage in a certain product can be recovered by turning part of our capacity in manufacturing into production of this product. So if we have flexible manufacturing capacities, kind of using advanced manufacturing ideas, then this can actually complement the inventory that you have that might actually help you to be resilient in the short term. And then the manufacturing flexibility might actually take over the inventory measure in the long term. Okay. And then, of course, as I said, no preparedness is enough. So you will still have some events that go through your shield, preparedness shield. And then at the end, we also have to have a set of measures that are in the response category. So this is, we all know that we try to mitigate, we try to apply the preparedness measures, but at the end, we still have a shortage of a product. And then these are the types of measures that will help us to actually manage the shortage. So this could be reducing usage of a product to necessary levels, for example, to mitigate, to respond to the shortage that we're already experiencing. So this is just kind of the big framework that we have been really kind of talking about and presenting around around this issue. And the other thing, and this could be the last thing that I talk about again, is to really kind of bring it back, bring the message back to the fact that we have to look at what we want to really do is to build a resilience strategy that is a mix of many different measures. And what mix is the right mix depends on the likelihood of a disruption or the risk in the supply chain and the impact of that disruption. Or, as I said in the beginning, the criticality of the product. So when the likelihood of a disruption or the risk in the supply chain is low and the criticality of the product or the impact of that disruption is low, maybe the best strategy would be do nothing because the impact and the risk are low. On the other hand, if we have a supply chain with high risk, and that is for a product that is really important and critical, then we start thinking about kind of the upper right hand of this box, which really starts thinking about hold a lot of inventory because there's a lot of risk and the product is very important. So we really have to hold inventory at high levels. Okay. And then we can use this kind of a graph to really start thinking about what is the right mix of the resilience measures that we talked about earlier is right for that particular product with the particular supply chain. Okay. So this is the summary of the recommendations that came out of that report for the different categories, but this is particular to the medical products. And I can leave this for everyone to kind of browse through, but we don't really have to go through this. It's just a set of examples. But Saydeep, I think I'm kind of over my time, so I'll let you ask me questions.
Yeah,
and I can leave this screen on, or I can turn it off, whatever you like.
Yeah, I think we can leave it on for the time being. Let the audience browse through this as you suggested. A couple of points. I think you have made your framework is very clear and very understandable in terms of approaches that one needs to take. And you said there were two key insights. And one of the insights which you mentioned was that no one size fits all strategy. That means you have to adapt to the different types of supply chains and different types of products that one has, and of course, different types of challenges. So for better understanding of all of us, can you give example of how two different approaches, because you said no one size fits all. This is a very perfect statement. Now, can you give an example in the medical and the non-medical products field so that we can understand, the audience can understand this a little better?
Okay, so I can try. So as I said, I think really, I will actually go to this graph. I think this is kind of what should guide a supply chain resilience. So for example, I will talk about one product that I have experience in the medical side, which is saline. And saline is salt water, basically. So if you think about it from kind of an uneducated perspective, it is an easy product to make. I mean, you can make saline solution in your kitchen, okay? So up until like 2018, 17, 18, when several hurricanes hit the US, like Maria, Irma, and Harvey, actually, the United States paid no attention to saline solutions. Although it turns out saline was a medical product that was in shortage for the last really 20 years in the United States. It turns out saline is extremely important because it's used in everything in the medical sector. You need to have saline to administer drugs. Anytime you use an IV, you need saline solution to administer the IV. Any surgery needs saline solutions for many different things. Dialysis machines need saline solutions, and so on and so forth. So it turns out it seems to be a simple production process. It seems to be kind of a simple product, but it turns out it is a critical product. And I think this was not really kind of noticed by in the United States, we have a strategic national stockpile of products. Saline is not in that. On the other hand, it is a critical product. So not only that, after Hurricane Maria hit Puerto Rico, we realized that the saline supply chain was actually very, very vulnerable because 80% of the production of saline that was used in the United States was made in Puerto Rico. So putting 80% of your manufacturing of a critical product into an island that is not even on the mainland, but furthermore in the hurricane belt, does not seem to be very resilient. Furthermore, so I'm just kind of like giving examples of all the things that went wrong. Not only that the supply chain was designed in kind of with a blind eye to risk, but furthermore, nobody was aware of these facts. So I was again in this other committee that did a lot of after study after these three hurricanes hit the United States and its islands. And I talked to the person who responded to calls from the several manufacturers that were manufacturing saline on Puerto Rico. These manufacturers had lost power, so their facilities did not get damaged, but they lost power, and but they had generators, but eventually their generators ran out of fuel. So they called the emergency management agencies asking for fuel. And I actually talked to the person who made the decision of not sending fuel to these manufacturing facilities because he didn't know what their importance was. He asked around. He personally told me, he asked around and nobody told him anything. And he decided that this was private sector and they were supposed to get their own fuel. So they're not the kind of the National Emergency Management Agency and the people who were doing it in Puerto Rico at the time decided not to send fuel. So these hurricanes hit in kind of September, October. We were actually canceling heart surgeries within the United States the next year in February, March. So this is an example of a real world, like an experience that we all lived through. In fact, I had to have a surgery that got canceled because of a saline shortage in Boston in February, which was kind of really interesting because then I got into this discussion with my doctor and the hospital saying like, I do research in this, like, tell me more, what's going on. So this is an example that I think is a good example of what all the things that went wrong. Now, if you look back at this with an eye of like what could have been done, first information and the awareness, right? We should have known that there was a huge risk. around the supply chain for this critical product. Second, we should know that we should have known that chronically saline was in shortage because its manufacturing processes were not hardened. In what I mean by that is that actually the shortages, kind of the chronic shortages in saline, is due to a lot of sanitary issues within the manufacturing processes. So this indicates that the manufacturing processes are not secure and kind of sustainous, they're not at the level that is required for a product such as saline. So there could have been done more hardening. And then diversification, of course. And then we should really think about, what are the inventory options that we have with saline and production, manufacturing flexibility and so on and so forth. I don't know if this is a good example, but it's something that I'm very familiar with.
No, I think you have really, this highlights a very important learning for all of us, that what you mentioned at the beginning of your introduction, that typically companies, countries look at product criticality or product importance, but forget the other axes, which is the shortage risks. And I think this diagram that you have put up, it was a very interesting diagram in that sense that it you should not look at one dimension, but look at it in a two-dimensional view, and then take the mitigation as what you call actions or policies. I think that's a very, yes.
Yeah, and I like to also respond to that, because I'm seeing a question in the Q&A box about just-in-time inventory and zero inventory. So actually, it's not just two dimensions, right? When we're designing a supply chain, the resilience has the two dimensions, but when we're designing a supply chain, there are actually more dimensions, and part of it is cost, right? And because of that, many supply chains over the last 30 years have moved towards just-in-time inventory and really inventory reduction throughout their supply chains. And it is true that this idea has driven supply chains to be much, much more vulnerable to disruptions. And I think what we are kind of advocating for is that we need to really have cost-efficient supply chains, of course, because these are commercial systems. But at the same time, optimizing a supply chain just from a cost-profit perspective without any consideration to resilience and risk is kind of short-sighted.
Right. Wonderful. I think very true. But one question which keeps coming back, you did talk about mitigation of the risk through diversification. And Japan is very famously took this up in 2019 when they started having problems with China. And they, as a governmental initiative, they put almost $1.2 trillion to find alternative sources from, so they, in fact, they called it China plus one, as you probably are aware. So this diversification is a alternative to the other things like stockpiling and inventory buildup. Would you agree with that?
Yes, of course. I think diversification is one of the first things that any supply chain has to think about. But again, we should not be blind to kind of the complexities, or we really have to think about diversification in a smart sense as well, because you can, if let's say you are diversifying from out of China, but then you're going and starting to buy from, I don't know, like from this other country, and everyone is buying from that same country in the where the manufacturing facilities are in the same region that is vulnerable to earthquakes, right? That is not diversification. And what we actually see is that that happens a lot, that a lot of both countries and companies are myopic sometimes when they're trying to come up with a diversified strategy. So I have another example from Hawaii, because Hawaii also experiences extreme events. Many organizations there, both public and private, has some diversification in terms of how they get power in case of a disruption. So they have generators and they have different sources where they have agreements on in terms of where they can find a generator. Well, it turns out while both governmental and for-profit organizations have contracted with this one company for secondary generators, it turns out this one company, while making many of these contracts and promising a secondary generator, it really promised the same generator to 40 different places. So, I mean, it's really, so this is actually a real case study, and that was discussed in that first report. And so that also shows that diversification is something that needs to be done kind of in a smart way, and that awareness and understanding of the the global picture is very important, because otherwise you might actually have a false security, a feeling of false security, thinking that you're diversified. But really, if you look at all your other competitors and everyone else is also diversifying at the same place, might not be the best strategy.
Wonderful. Thank you. I think that example paints the picture very clearly. I had a sort of follow-up question on this slide, the one which you have presented. The first part is relatively easy to understand for all of us, physical buffers or stockpiling. Can you give some example of this contingency planning? What exactly does it mean, and how does one company or a country create this contingency plan, and what are the factors which become critical?
So contingency planning is really, I'll go back to my, my preparedness and my framework. Again, it's kind of thinking about, okay, we run out of inventory, right? We don't have extra production facilities. Now, what do we need to do? So first of all, what this says is that we need to think about what we can do in that situation and have a plan for it. So examples could be, if we, let's say we're using product A, and so this happens in the medical sector a lot, when a health system sees that a product is kind of going into shortage and there's a problem with supplies, they start talking to the clinicians and start saying that, can we move from product A to product B in the clinical setting? Meaning that we start actually administering a different product or different drug to the patients. Or it could be, for example, again, from an example from the medical sector, a lot of the drugs, especially liquid, steriles and other liquid type of drugs, can't come in bags. And usually there's a particular volume that you want to use for a particular process or procedure. So what you do in your contingency planning is, like, if you run out of one kind of a bag, then you start figure out how to use other volumes to administer in a certain process without creating huge waste on a shortage product. So those could be examples.
Excellent. Thank you. In fact, this slide of yours is a very, how do you call it, loaded slide. a lot of things in
It
it, and but it's an excellent visual presentation of the concepts that you talked about. Uh, just to on the response side, I had a question because our neighbor Pakistan
Mhm.
recently is going through some a sort of a crisis in terms of foreign exchange availability, and therefore they asked their populace, people in their country, to cut drinking tea because tea is an imported product,
Mhm.
and a
Yeah.
lot of good money is getting wasted importing
Mhm.
tea. Tea is not an essential commodity. So, as per the governmental people.
Well, it's not an essential commodity if you're not Turkish. I'm Turkish. It's an essential commodity.
No, no. This is exactly the reaction of the people of Pakistan. That was the
Yes.
point. They
Mhm.
said, you government guys seem to get your fix of tea from somewhere, but for us, tea is an essential commodity. And therefore, uh, what, I mean, you have been there, you have seen that, and many crises you have worked
Mhm.
with. Uh, can you give some example of this, of how demand, are you talking about an alternative product in substitute for this, or how does demand get reduced?
So, I mean, actually, the tea example is a good one to
Mhm.
because at one point, you do have to make a decision on what is really critical and what is not, and you do that. So it could also be messaging. So an example for that I have seen in actually we've discussed this a lot with the former FEMA director.
Mhm.
Director Fugate, who was really a famous guy in the United States in terms of emergency management. And his big thing was during hurricanes that hits Florida and the southeast part of United States. A lot of products go into shortage, but most importantly, fuel, because everyone goes to the gas station and they try to fill their car because a hurricane is coming in. And it's really so it's not so in a sense the actual demand is not high, but
Mhm.
hoarding happens, and because of that the demand increases. So there could
Okay.
be a lot of kind of messaging or kind of even rules around how much you can buy, right? Also you can start seeing like rationing of water or other types of sales, because it's kind of like, I would say, not just demand reduction, but in a way, demand management.
Oh,
So you have to, I mean, when you have limited resources, you have to allocate um, in a rational way. I mean, there's really no other way of doing that. But it's really, I would say, it's not just also rules and regulation, but also messaging, kind of. Also, one thing that we see in the medical sector that is very effective is to tell the health systems, uh, give trustworthy information to the health systems so that the health systems calm down about the possibility of a shortage. So if I know that there is 100 or like 90% guarantee that I'm going to get my products in the next 2 weeks, I might actually decide not to hoard or decide to kind of do this demand reduction on my own. But if I have no information and if I have no trust in the system, then I'm going to hoard because I don't trust what will happen in the next 2 weeks. So that's also kind of a very important aspect that we always talk about.
yeah. Wonderful. Thank you. I think that clarifies a lot of questions in the mind. One more earlier slide, you did talk about um, how onshoring is linked or should be addressed or should be analyzed vis-a-vis cost effectiveness, which
Mhm.
of course is common sense, which is right. But have you come across any situation where the company or the government has taken a stand that though it is cost ineffective, we will bring it on board, onshore.
I mean,
Does it make sense?
of course, I mean, and the answer is I don't really have one particular example to that, but of course it's a lot of politics. I'm sure not only in the United States, but all around the globe, that there are a lot of the calls around onshoring is really politics, and kind of, again, like not putting a fine eye and examining the situation with the data and analytics and trying to come up, rather than trying to come up with the best strategy. It's really kind of more like speaking to the crowds and more on the political side of onshoring. Of course, I mean, sometimes it does make sense to do onshoring if you have a very critical product, although it's expensive. But we have, all we're saying is that it should be, as any measure, onshoring is also just one measure that should be evaluated as any other measure.
So would, for example, recent crisis, which you did mention about the chip shortage across the world, people have felt shockwaves of not having enough chips. So then they say it's a national security issue, and therefore we must bring all chips production in-house.
And the question is it all, right? But like some, yes, maybe,
Okay. So you're saying the third dimension could also be the national or impact, in a way, impact, parts of the impact.
It's the impact, right? So that the national security is one angle of the impact.
Impact, yeah. Very right. Thank you.
So I see one small question here that I would like to respond to around, kind of what happens what are the global dynamics, unequal global dynamics when we're affected by an extreme medical situation such as a COVID pandemic. And that's a very good question, in the sense that, part of the reason that my committee was called was kind of around these issues. And so I personally also have a strong belief that we need to have certain global treaties or measures and agreements where we actually kind of share and not hoard any products, although obviously for politicians this is a very hard thing to do. So actually part of the committee's recommendation was an international treaty around the use of supplies or the distribution of supplies, and kind of promises that that countries can make potentially of not limiting its supplies to be distributed under an emergency situation. Although, I mean, of course, this is one of the hardest recommendations to put in place, but we do have other global treaties, and we believe that this is an important one, because as soon as you start closing your doors, I think you start influencing unintended actions all over the globe, and it actually turns out to be kind of worse for everyone at the end of the day.
Right. Dr. Aslam, can you go to the next one, the last slide, which you had asked people to, next one. Yeah, you did very interesting point comes up here is in terms of how does one look at mitigation. You did talk about something, quality and reliability. Can you describe this a little better for people to understand?
Of course. And I mean, thank you for pointing, because I think this is one of the most important points, at least that we discuss domestically in the United States, which is currently, especially in the medical products sector, when a health system is buying a product, The only dimension that a contract is being made is on price. And when you think about it, especially in the medical, the health system, health sector, buying or contracting or supplier selection just on price dimension is very short-sighted. But if you go and talk to the health system, supply chain managers in these big health systems, they say that they have absolutely no visibility into the quality or the reliability of a certain manufacturer or a certain product supply chain. So they cannot contract, or they cannot take into account the reliability issues when they're contracting. But as you can see, immediately, right? If you don't contract, if you only contract on the price, this sends not the best message to the producers and the manufacturers, because then they're only working on driving the cost down and not really working on the reliability of the supply chain or the quality of the product. So if we can actually have information that is shareable with the consumers around the supply chain reliability and the quality of the product, then this will enable the consumers to contract or to buy not only on the price dimension, but also on the risk dimension as well. And this in turn will help to incentivize the manufacturers to build more reliable supply chains and better products.
Thank you. One, from my side, one last question, capacity buffering. It's a difficult concept to understand. Can you explain a little better what it means and how does it practically can be applied by
So the capacity buffering is really around manufacturing and manufacturing processes. So it could be as simple as having extra capacity in your manufacturing processes that can be put into use in case of a disruption somewhere else. In the medical sector right now, actually, most manufacturing lines are working above 90% utilization, which makes for a very kind of fragile system, as you can say. There is really no buffer. But it could also be not only what is the utilization on your manufacturing lines, but it could also be the kind of the technology around the manufacturing, where you can actually, are you able to convert one line from one product to another if it's necessary? So that's also buffering, right? So it doesn't have to be an empty manufacturing line just in case there is a problem. It could also be building or kind of paying for advanced technology and more flexible technology so that you can actually do changeovers from one product to another easily if needed.
But when you are giving your recommendations, would you say that the capacities must be, say, not more than 80%? Is there some magic number like that?
No, I can't. Again, I would say, because that would be one size fits all. It really depends. It really depends. At this point, though, kind of going back to that first question around just-in-time inventory, just-in-time production, just-in-time everything, lean systems, the last 30 years in operations have been driven by this kind of ideology of lean systems, which is fine. Of course, there is a reason for it, but that ideology actually drove all our systems to very, very high utilization points. And it's not a secret that if you have 90+% utilization on any system, the system is not going to be resilient to disruptions. Same as the airlines, right? In the United States right now, we're having crazy amounts of cancellations every day because most of the busy airports are working with 99% utilization. Wow. So there is no room for buffering a disruption.
Right. Excellent. Yeah, okay. Now, coming out of this these slides, I want to ask you, as a person who has worked as a member of many national academies, committees, can you elaborate what are your learnings as an individual, as a professional, on working with these committees?
That's a good question. It's been, to me, working on these national academies committees, the most important learning is really seeing the diverse perspectives, because when these committees are put together, usually the committee members, there will be a few academics like me, one or two, but the rest of the committee will be coming from all over the sector to represent different views. So for example, in this medical product committee, we actually, the current FDA head was part of our committee before President Biden actually appointed him as the FDA head. So like we actually met him and worked with him in the committee, and now he became, now he manages FDA in the United States, Food and Drug Administration. So it's been really, really interesting, because I got to see and hear and work very closely with both policymakers, public sector, private sector, academics, users. I got to work with a bunch of medical, like in this committee, we had many healthcare professionals who actually experienced the impact of these shortages, whom we work with. So it really is a learning process because of the diversity of these committees. And I think that's the most important part, that you actually grow in your thinking as you hear the different aspects of an issue.
Thank you. Mm-hmm. But just the response side, one point keeps getting troubling in different contexts, because India is also going through that. Therefore, I'm focusing on that. You did talk about the 6th point in the slide. Mm-hmm. Yeah. So the international treaty. Now, India as a nation seems to be losing faith in multilateral arrangements because of politics. So they seem to be getting more comfortable with bilateralism. But what is your, maybe it's not your field, you can refuse to answer this, but what do you think? What should a country do? Is it a multilateral approach like the WHO or world organizations, or bilateral agreements between companies or countries would be the way forward? What do you think in these type of treaties?
It's okay. My answer seems to be, it depends on everything, right? As a systems point of view, multilateral is always going to be best, right? Because if you have a limited resource, let's say, or a global system-wide problem, you can best use resources, allocate your resources, and come up with strategies as a like from a system perspective, which includes all the stakeholders. However, from a individual perspective, right? So like a country like India or any other country, obviously getting into some bilateral agreements could be, at least in the short term, could be better, in the sense that you're guaranteeing a supply, let's say, or you're like obviously it's easy to see that in certain circumstances in the short term, some bilateral agreements will be beneficial to individuals. However, it will always hurt the system as a whole. And I also believe that in the long term, when the system is hurting, in the long term, no individual player will actually be better off. So again, my personal opinion is always going to be for kind of system-wide international solutions rather than bilateral and kind of myopic solutions, but with the understanding or acknowledgement of the fact that these myopic or short-term solutions will work better in the short term for the individual. Like, and that's why we always do them, right? Like you take an action because you know that it's going to benefit you in the short term, and it's too hard to think the long term.
Very right. And you're right about the short term and maybe also quickness in response, because when you have more than
Yes.
two,
Mhm.
always
Yeah, of
more
course.
negotiations and more discussions and more time is wasted.
Mhm.
You're right.
So
But,
I mean, I would say then the best approach is probably both working with some kind of an international treaty or international organizations, but also managing a set of bilateral agreements as well, right? I mean, that's usually how things work. Like you kind of find a subset of things that work together.
yeah. Okay. Wonderful. Thank you. And we have one question from the audience. I will read it out. Would the ability to foresee or detect the disruption early enough, could that be a factor that means some sort of a predictive analysis through analytics and so
Of
on?
course, it's a great question. Actually, I'm sorry, I saw it. I wanted to respond to it, but then I forgot.
Sure.
Of course, it's one of the, I think, most important things that will make a supply chain or any system resilient. The ability to see and to predict the impact of an event. So, for example, in pharmaceuticals, usually the impact of, let's say, a production shutdown is not felt until after a few months passes, right? Because there is inventory in the system and nobody really knows about this production shutdown except for the manufacturers. So you don't really realize that there is a forthcoming shortage of supplies. However, if this was, for example, if this information was shared with the network, then you could see that health systems or other users of the product could start reacting to it earlier, which will always be better than later. But it is not, I mean, as I said, it is a really, really good question. I think we should build systems where there are early warning signs, but sometimes it's hard to understand what is going to create a big event, and like if an event is going to create a big impact or not. So we should actually, I believe, build analytics also around not only detecting events, but also predicting analytical tools that will predict the impact of the events down the line.
Well, one final question from my side. Do you see that the committees you have given, you are from the academic world, and there are many people on the practicing side, and given some weighty reports, do you see that these things are put into practice by the people, and you see some results coming up?
It's a very good question. Of course, it's a question that's in our minds as well. So I think there is an impact. I don't think there is an immediate impact, especially nationally in the government. But I do know that many groups within the United States government is taking these things seriously and starting to build at least some of the capabilities, analytical capabilities, to start thinking about what is the best strategy. I know that the Department of Defense, for example, is really working on a strategy, building a team. So there is movement, but it will take time,
Yeah, it moves, but moves very slowly. Yeah. Like any comments.
Although I must say, the more shortages that appear on the cover of the major newspapers, the movement gets a bit faster, right?
Okay. Nothing like public opinion, yes.
Mm-hmm. Yeah.
as we have seen in our neighboring countries, public opinion or public unrest can be very disruptive, and it can throw out governments.
Yeah.
So, and sometimes violently. So,
Yeah,
yeah.
that's true.
And very spontaneously that way. I mean, it's not something orchestrated by anybody, but it is very spontaneous.
Yeah.
Thank you, Dr. Aslam. It has been a very illuminating and educative, informative session for all of us. And thank you for taking time and sharing your thoughts. And I think there's a great deal of learning. As you mentioned, many countries, the developing countries, can learn from all these case studies that you mentioned in your talk, and try and not learn the fundamentals, which somebody else has already gone through. Thank you. And one request from the MISC at IIMB, we would like you to continue your association with this Center of Excellence, and let us see how we can work together on many other things. Yeah.
Thank you. Thank you, of course. Thank you for inviting me to speak.
Goodbye.
Thank you.